Hello everyone, in this video we are going to talk about the prenatal care that you can give as a body worker, a chiropractor, to help your pregnant patients in the first trimester. The most common condition we see in that first trimester, 1 to 3 months, is general low back pain. Nothing exciting really there, but there's some really easy tools that are simple if you niche down, and you can provide these exercises, these tools for your patients, and then they can help themselves at home while you are also helping them in the clinic. So we will go over both in clinic and at home things for you and your patients. My name's Dr. Cassidy.
I'm Dr. Mariah, and I am approaching 36 weeks.
So exciting. And so we wanted to get this filming done. So she is not in the first trimester, but she is pregnant. So give us a really good idea for when we need to be conscious of belly and the space that we're giving it. So without further ado, we're going to go into some of these simple stretches. We've just narrowed it down to a handful. First one is going to target the lovely piriformis muscle. Dr. Mariah is going to be in the chair. I'm going to be on the floor. The floor is a great option for those bendy patients, those really flexible patients, especially that first trimester when they don't have belly to interfere with their space. So to get in the stretch, simple figure 4 on the ground or chair, inch that leg up on the ground. Mariah's gonna lift her knee towards her chest, give it a nice hug as she sits up straight in her low back.
Nice and tall.
And then we're both gonna add a twist. I'm gonna add mine by dropping my knees and twisting my upper body, and then Mariah simply just twists her torso over that shoulder. And then we come back up. Whenever we're demoing these stretches in the clinic with the patient, we always do both sides. It's really important that your patients understand what they feel side to side, what side is tight, why they are feeling it. And it's a great segue for you to discuss why they have pain in one area and why we are adjusting in another area, because we do not adjust pain, we adjust the sticky stuff.
Exactly. Yeah,
Awesome.
that was really beautiful.
Okay, cool. So we will do the other side just because we're here. It's the same positioning and twist. Mariah's got the chair option because she wouldn't have this available to her with the belly right in front of her knee here. That's incredible. I think we kind of get the picture there. Pick your favorite piriformis stretch. And now we are going to head to the ground. So Mariah's going to get there safely.
Thank you.
I'm just going to pivot.
Coming down into a squat. We'll certainly touch on this, but anytime we're moving on the floor, from the floor up and down, we highly encourage our women, our patients, to keep both feet on the ground so that there is less of a shearing force at the pubic symphysis. But we'll get there.
That was awesome. Nice little segue to the ground. I'm gonna have Mariah get into a tabletop position. So when we are talking general low back pain, especially at this stage, we see a lot of muscle tension in the lumbar paraspinals, and a lot of times that is because of fatigue. So cat-cows are simple. We're gonna have Mariah drop and relax this belly towards the ground, lifting her head up, and then she can go into her cat position, rounding through the lumbar and thoracic spine, pressing the ground away. And that is beautiful. You can either keep going, whatever feels nice if you need the stretch, but I'm just gonna start gabbing. So general low back pain, movement generally feels good. And like I said, those muscles get tight, overworked, and fatigued. At this point in pregnancy, most women are still doing their everyday activities that they do outside of pregnancy. They can move normally because they don't have belly in the way. They maybe don't even have pain starting until this low back pain starts to creep up. So they are generally not being mindful of their activities. And you should be, obviously.
Right. That's true, yes.
So true. And big piece of that being in the first trimester is that relaxin, which if you watched our continuing education course, we have already covered that relaxin piece. So we're not going to touch on it anymore, but we will go into our next stretch. It targets your psoas muscle. This kneeling one is our favorite. So Mariah's going to find a comfortable position on the wall. We always have our pregnant woman supported with something, a wall, a chair.
I'll say coffee table, wherever
Yeah.
you're, right? Something in the home.
Just because then they don't have to worry about the balance factor, right? They can really focus on stretching, relaxing, and breathing through the stretches. So you'll lift the knee up, that's against your base of support. And then I'm actually just gonna have you shift this way, and we're gonna kind of change spots here. Perfect. So knee up against your support, and Mariah is going to slightly tuck her pelvis under, not even a ton, and then lean into that front leg, driving forward past the ankle. We're not doing any strength, right? We can drive this knee past her ankle. It is safe. She can relax and breathe here. If she needs more, she can take this hand to add that twist. That psoas muscle has that twist. It gives our body that twisting torque in the trunk. So adding the twist gets that upper part of the psoas muscle a little bit more. I always start without the rotation, and then I give the woman the rotation because rotation adds that torque. So it might not be comfortable for everyone. Incredible, Mariah. You can now show them the lovely technique we use to get up off the ground. So go for it.
Especially if your patient, your woman, was just in that lunge stance, we don't want her getting up in the split lunge here. So I'm coming back down, both of my feet are on the ground, tuck my toes into this low squat if possible, and then standing, or from tabletop, I can walk hands and feet together.
Awesome. And then, that was beautiful. Sorry to cut you off there. We are just going to cruise through our last piece. It's tilts with an exercise ball. We like to put this in here right away because we love when pregnant women have their ball right away. They should be on their ball from day one. They can start wiggling and getting used to their ball and being comfortable sitting on it. So Dr. Mariah here is just tilting that pelvis back and forward. Should feel really nice on those paraspinals for your patient. And it's easy to do. They can do it watching TV or whatever. Now let's talk about the products that you, one, can recommend to your patients at home that they can use to help themselves when they are experiencing their general low back pain. First being this wonderful self-inflatable lumbar pillow. As you can see, this little knob, that's how it inflates. You inflate it to whatever is comfortable. You then can place it behind your low back in the car if you drive a lot, on airplanes if you fly a lot. Maybe it's on your desk chair.
Because it deflates and rolls up, so you can easily stick that right into your purse.
Yes, very travel friendly. And then another that we're just going to briefly mention in this video, we will get further into this product as we go because it's going to be a big player in future conditions in pregnancy, and that is an SI belt and a sacroiliac joint belt. It's a great option, especially if you cannot get your patient past their low back fatigue, low back pain. This can add some support to your pelvis, not your low back, which helps with the low back fatigue. Right. So to put this on, we are going to demo on Mariah because a lot of people don't use this low enough. We want to support the pelvis. We are not lifting belly. Belly bands, which is another totally different band that you can use for general low back pain in pregnancy, supports a pregnant woman by lifting their belly up, which might be a great option for some, but what results is that those muscles don't work at all then, and they get more sore when you make them work. So Mariah's putting that on. She didn't really even need help, which was great. She's done this a time or two in her day. Beautiful. It's below both her pubic symphysis, covering that ilium back, and then I'm going to have you turn to sitting essentially right below her PSISs, squeezing that pelvis in to provide stability. Awesome. You can, yeah. A lot of women say it feels like a nice little hug. I love it. Thank you, thank you. And then the last piece we're going to do is we are going to show you how we like to manually release the psoas muscle in office. So in order to do that, we always like to use a wedge and a lovely little dowel pillow. So then Mariah, whatever pregnant patient we are working on, can lay on her back without any concern of vascular issues. So she is going to scoot her bum to the edge of the wedge, lie on her side, and then she can come on back. Just like that.
So cozy.
So cozy. And then I'm going to squeeze on this side of you. Both knees can be bent or straight. Does not matter. You're going to find the psoas muscle by finding the crest of the ilium and diving those fingers in. And then Mariah can straighten her leg down to lengthen through that muscle manually, and then she can come back up. Pick your rep count, make it a rule of thumb. We always do 3 to 5 here. Do what works. That's beautiful. And up. If that is too intense for your patient, you're gonna wanna try a passive release. That's gonna look something like you straightening the leg while you massage. So a little bit more in depth there. If you have any questions about how to help your pregnant patients in their first trimester with their general low back pain, leave it in the comments and we'll cover it next time.